Okay, the next article in our journal series is The Etiology of Primary Femoroacetabular Impingement, Genetics or Acquired Deformity. This comes to you from Stanford and one of the past presidents of the International Society for Hip Arthroscopy, Dr. Mark Safran, and his associate author, Dr. Packer. What these articles are intended to do, as you recall, is to give you a summary review and introduction, if you're not familiar, with some of the modern concepts in athletic hip surgery. As you read through this, you'll need to understand that there is such a thing as femoral acetabular impingement, or FAI. And when you look to determine what kinds of femoral acetabular impingement are there when you're looking at an x-ray, you're looking at either deep cup impingement or cam impingement, where the ball, instead of looking like a golf ball on a tee, is out of round. The cam deformity and how that develops is exactly what we're going to see Dr. Safran tackle using the medical literature and his knowledge as an expert to try to explain to us, where does it come from? And as a trainer, you're often going to be asked by parents, if they've gone to see the doctor and been told they have impingement, hey, well, how did they get it? And what we want to be able to do after we read this article is examine the genetic factors that are attributed to the development of the cam. Got to examine those and know those. And you want to recognize how common is it, so you can reassure them that cam lesions are very common in certain sporting populations and do not require surgery, whereas in other populations they may be a little bit different. And you also want to be sure to understand how this cam impingement relates to those athletes' performance maneuvers, and this is all covered inside this article. So I certainly hope that you found this to be some good context and background and understand why it is we've picked this article, and you could use the references from this article to follow in your own quest for more knowledge, and hopefully this helps shape again your understanding of the modern treatment of the athlete's hip.